are there. Then we can.
Yes, they are there. Okay. So, very good morning, everyone. Thank you for being a part of this active exhibition, which focuses on arts and crafts made by patients suffering from mental illnesses. We are delighted with the response that we have received. There are around 15 entries from Maharashtra, Gujarat, and Goa. Before we begin, I would like to welcome Dr. Neena Samant, ma'am, President, Indian Psychiatric Society, Western Zonal Branch. Welcome, ma'am. Thank you for your esteemed presence. Secondly, I would like to welcome Dr. Sushil Gawande, sir, Chairperson of Arts and Cultural Subcommittee of IPS Western Zonal Branch. Thank you, sir, for your guidance. I would like to also welcome the Secretary of IPS Western Zonal Branch, Dr. Dhananjay Asturkar, sir. Thank you, sir. Before we begin, I would request Dr. Neena Samant, ma'am, to say a few words regarding this exhibition.
Good morning, everybody. Thank you, Sanjana. And it's nice to see so many faces early morning. Yes, Dhananjay, Rajesh, Dipti, Sushil, and the young brigade, which is all done a lot of hard work in trying to get this exhibition, which is an online exhibition of paintings by patients with mental illness. Now, we have had one session where all the members had participated, and we also had one session where members wrote poetry regarding mental health and creating awareness. Theme was mental health. And today we have an exhibition which is art done by our patients themselves. And when we look at art as psychiatrists, yes, we know that art is used as a form of expression, where probably we will also come to understand what a patient is going through or trying to depict through his pictures. And so many psychologists use DAPT or House Tree Person, etc., as projective tests. So it definitely requires some amount of skill to identify what is being depicted on the painting by our patients. But along with it is a great source of expression. And art is used as therapy for all our depressed, anxious patients. And we do advise people to, doodle or, express something. So it is to reduce, it acts as a stress buster. So we are all aware of these forms of art. And as psychiatrists, I also think that when I see somebody painting or doing good art, I do often tell them to consider it as a vocation more than a hobby, because we do have to rehabilitate our patients also. And so if you see this, you see this quality in them, I think all of us as psychiatrists do go out and inform parents that this should be further developed, or this creativity should go a long way. So with that, let us see what we have collected from our patients from our zone this morning. And as I as I discussed with Dr. Rajesh and Jeet, maybe in the coming annual conference in October at Mumbai, we will try to project these paintings also as a wall for exhibition of art by our patients. And if we can get more entries by that time, it would be good. So we will definitely keep a wall reserved, which would be an electronic wall reserved for art by our patients with mental illness. With that, let us now go ahead. Over to you, Sanjana.
Thank you so much, ma'am. Now I would request Dr. Sushil Gawande, sir, to say a few words and share his pearls of wisdom.
Thank you, Sanjana. Thank you so much. I hope I'm audible, Sanjana. Am I audible?
Yes, yes.
Yes, yes. So I would
Yes, sir, you are
reiterate.
audible.
Yes, I would reiterate
Yes,
same
sir.
thing which Neena Samant madam has just said. First of all, thank you, Neena ma'am, for giving motivation to hold another program of Art and Cultural Committee. As I am also a chairperson of Art and Cultural Committee of IPS. So I tried to keep a balance between national program and Western Zonal program. So first we had a program of poetry of Western Zonal branch, and then in between I had a program of online art exhibition by art and craft by psychiatrists at national level. And then it was a turn of West Zone again, and then I brought this concept, and I think the such type of the concept is happening for the first time. The three objectives, two objectives are already told by Nina ma'am. I think art and culture is something, it's integral part of a psychiatry. So first objective, as ma'am said, we can understand the psyche of the patient. Secondly, very nicely, madam has told, some of the artists, they are so professional. Once you will go through their paintings, that they can work as a professional in the field of art and craft, and that would be a good rehabilitation for them. Thirdly, by holding such type of the exhibition, it will be motivation for many institutes in the West Zone to conduct such type of the activities in their ward. Now, when I say ward, it doesn't mean a chronic stay facilities. Even in acute care facilities, such things can be conducted. Once the patient is stable, maybe after a week or 2 week, he can get involved into such type of the activities. So it keeps the environment of the ward very vibrant. It gives them a motivation, and it helps in early rehabilitation. And thirdly, once they are every day involved into such activities, they are not behind us for the discharge. Otherwise, every day in a round, some patients and the relatives are there in the round only to ask for the discharge. So once they are involved into such activities, so it would be a lesson for every one of us to learn that even in an acute care facility, once they are stabilized, we can start with such type of the art and craft in our wards. So I am thankful to Nina ma'am, Dhananjay, and all my committee members. They are so motivated, and it's a teamwork. So without help of Sanjana, Priyanka, Jeet, Gaurav, and Monali, it's not possible to hold such programs. So thank you, my committee members, and looking forward to have a similar cooperation in the future. And with this, hand over to Sanjana for the further proceedings. Thank you.
Thank you so much, sir. Everything was very well put by both you and ma'am. Now let us begin with the
Start with the state of Maharashtra. Rajesh sir, I am audible and I think screen is visible now.
Yes,
Yes, sir. Yes, sir.
Huh. So first entry is from St. GS Medical College and KM Hospital, De-Addiction Center. These are the paintings. Beautiful paintings. Any representative from KM Hospital De-Addiction Center, if you can elaborate?
Good morning, sir.
Yes,
So I'm
good
Dr.
morning.
Parijat. I am from the Department of De-Addiction Psychiatry, KM Hospital.
Yes.
And a very good morning to all of you. So this painting was portrayed by one of our patients, a young female in her late teens, who was admitted in our center for cannabis and alcohol de-addiction. So during her admission, as she opened up, we came to know about her childhood history. And to be very honest, we were aghast. So there was no such childhood adversities that she did not face. So she was born to an unplanned pregnancy. And right from the time she could remember, her father despised her a lot. So she would have to undergo verbal abuse, emotional abuse, and at times physical abuse as well. So she narrated an incident wherein she would see all her colleagues being accompanied by their fathers to school. And when she requested her father to do the same, she was like, I do not love her. So do not expect me to go and accompany you. This continued over the period of time. When she got a little older, the father would become more and more physically abusive.
Okay.
At times, the father would force her mother to have intercourse when she was sleeping just next to them.
Okay.
She would just go and sit below the table just to shield herself. And this continued. Then she would also find packets of condoms, packets of sex toys in her father's trousers. And then she realized that the father was going to commercial sex workers as well. Then the father finally contracted HIV, which unfortunately he passed on to his mother as well. And when she was around 12, 13, the father passed away. But she carried this trauma all throughout. When she was 14, 15, she got into a very abusive relationship with a guy who was approximately 10 years elder to her. Again, it was verbally, physically, sexually abusive. She had to undergo MTP twice during the course of the relationship, but she could not just let go of it. And at the very same time, she was introduced to cannabis and alcohol. And this is how her history was. So she came for voluntary de-addiction, and every day after day 4 or 5, she was like, I want to discharge, I'm feeling very bored. And then we came to know that she draws very well. She has a knack, she has a hobby of painting. So we gave her papers, we gave her pencils, and she sketched quite a lot of pictures, but we decided to exhibit these two. So one was regarding the father, that a father holds his daughter's hand for a short while, but he holds her heart forever. So she claimed that I still yearn to have a father who would be there with me. And maybe if he comes to my life even now, I'll be a different person. And
Wow.
the second one was a hand holding a rose. So she said that my life is like a rose. It is full of thorns. But I sincerely pray, I sincerely hope that like this painting, my life will only be like a flower minus the thorns.
What?
So this is about the background of the portraits, sir.
Yes, yes. What a beautiful thought. What a beautiful thought. Thank you. Thank you, Parijit.
Thank
I'll
you,
go
sir. Thank you
ahead,
so much.
with the next painting. Sanjana, are you there? Okay.
Yes, sir, I'm there.
You are
Yes,
there.
sir.
Okay. So I am
Yes, sir.
projecting
Yes.
the next. You can
Yes,
carry
sir.
on.
Yes, sir. So next we have another exquisite art from the same institute, from the Department of Psychiatry. And the presenter for the same is Dr. Riva Sorathia, who's a senior resident over there. Dr. Riva, the mic is all yours.
Um, hello.
Hello. Hello.
Yes.
Hi.
Hi. I am Dr. Riva Sorathia. So today I'm here to present, I think, 5 of the most beautifully painted portraits by one of our patients. So briefly,
Sorry,
yes.
Hi, Riva. Sorry to interrupt you in between. There are just four entry from one
Okay,
institute.
no problem. So I think 4
Yes.
of the beautifully portraited paintings by one of our patients. So briefly speaking about this patient, she was suffering from functional neurological symptom disorder since past 1 year. And when she had presented to our OPD, she had excruciating facial pain, which was both distressing and disabling at the same time. So she was quite like the presenter like before me, Dr. Parijat Roy sir said about the trauma. So yes, she had faced a lot of trauma herself, and as we say, the art comes from pain. So we tried to treat this particular patient. So she's currently doing better in a way. And in a way, art has also helped her heal, besides the medications and the therapy sessions that we took. So briefly talking about these paintings, I think the first two are like the first one is Lord Krishna with his mother, so showing unconditional love and affection that she starved. So basically she did not have quite good affectionate relationship with her mother, and she desired the same. So through her art she pictured this first particular portrait. And the second one is of Lord Jagannath. So by the name, it goes Jagat is universe and Nath means master or lord. So the Lord of universe. So what is the most fascinating part that she mentioned regarding this portrait is that the Lord Jagannath's like being is just the face of it. There are no limbs, there is no neck, there are no ears, signifying that there is no end and there is no beginning. So that was the thought process behind the second portrait. The third one is a wheeled vestal. So it is a sculpture of 1847. It has also been featured in one of the movies, which is The Pride and the Prejudice. So it signifies goddess of health and home. So this particular wheel vestal was a virgin whose duty was to help the sacred fire burning in the temple. So it's one of her arts which she enjoyed doing, like the one of the portraits. Then the fourth one is of like while she was suffering from the disorder, she reported that this signifies a child, like basically a toddler. So initial years she was very fascinated by children, but her past experiences of the same, she hated it because her parents despised her, and she thought that the innocence that the child holds and the innocence that she held for a very long time was crushed. And so in these years, she thought that children were nothing less than nuisance. So I think this was the thought process behind her last portrait.
Dr.
Hello.
Eva, I have one question. Thank you for explaining it so
Yes.
beautifully.
Yeah.
Was there any temporal association between her illness and these portraits that she has painted?
Oh,
Like
ma'am,
before?
actually, sorry.
Yes, please continue. Please do continue.
Yeah. So, we had a bunch of investigations, like which had been done previously, also like before that she had been presented in our OPDs, but we found none such associations per se. To if that
Oh,
was precise.
all right. No, it's fine. No, I just wanted to know whether before she was all better, she had painted these
Yes.
pictures, and after getting all
Yeah.
right,
So
she
actually,
painted the
the
other two,
first.
the Jagannath, Lord Jagannath and Sri Krishna's.
Yeah. So she reported that in her like good mood was one of the most important influences and one of in the paintings. So the last one which she painted was during her illness. To be precise, and the first ones were basically the part of her college years. And she reported that whenever she was okay and in well mood, she used to have these sculptures of God and goddesses painted, and also sometimes scenic views and all. But when she was very disheartened and like dejected in her mental state of mind, she used to have these dark pictures painted by her.
Yes. So vibrancy shows us better state of mind in a way. Use of
Yeah.
vibrant colors.
I'll just like to add that she
ma'am.
came with intense pain as a symptom, and she would of course have some dissociative spells also. And the pain and the agony which she had would be all marked in the black and white pictures. I mean, she drew so many horrifying images of somebody in pain or somebody actually enjoying the pain. So
True.
I found it very difficult to analyze that why would
Yes,
she draw. So it was like how you would see in horror movies, those kind of all skulls.
It looks
and-
like Munja, ma'am. Munja.
yeah. No, she drew like that only. Of course, she had a lot of
Suffering,
childhood trauma
yes.
is there, but the most important thing is she just drew it from memory. No, she's not had any formal education in any kind of art. Means her family did not even bother to look into this hobby of hers, or she would just paint it when she would feel like. So she used it as an expression. And yes, when her mood used to be a little better or she used to feel happy, then you would see the color come out. Otherwise, most of them would be black and white, and most of them like this horrific faces or faces in pain, those kind of things would often be seen. She's got a big catalog of paintings. And in fact, after seeing that, we told her that why don't you show it somewhere or go for a
Yeah.
professional course? Means she definitely can do much better. but neither the
Yes, ma'am.
parents nor her actually thought in those lines. That is the
Okay,
saddest part. Yeah.
Thank you so much, ma'am. So now moving on, we have another art from Regional Mental Hospital, Yerwada, and the presenter for this session is Dr. Shama Rathod, ma'am. Dr. Shama, the mic is yours.
Hello everyone, I'm Dr. Shama
Hello,
Rathod.
ma'am. Hello, ma'am.
I'm representing Mental Hospital Yeroda, and we have occupational therapy department where a lot of activities are going on. So I'm representing some paintings as well as some artwork from our patients. So these paintings are from a male patients. The painting Serenity, Tranquility, sorry. The painting Tranquility, may I know the order please? Okay, the painting Tranquility is done by a patient. It's a landscape by an alcohol dependence patient. The other painting Day and Night, it is also done by the same person. Then the next painting is Slice of Life. It is a memory drawing done by a psychosis patient. And that was actually, this painting is when he was having symptoms. But we don't have anything to compare with whether this the color choice or the cluttering, whether it went away or not, we don't have anything to follow up. Then I have got a portrait.
Shama, just a minute. It's opening in a PowerPoint
Yes.
format.
Yes.
Just a minute.
That's wonderful.
Yes, Shama, we can go ahead.
Yeah. So I think they have not included the portrait. Anyway, I'll just skip it. Then there are the female section patients. They have done artwork. First is a crocheted frock from wool, and then alongside there is a mat. These things are prepared by two schizophrenia patients. One of them was discharged now, and another one is sent to a rehab, institutional rehab, because she was a long stay patient. Then the newspaper lantern, which is done, it is done, everything is been chipped in by so many patients because they have to do paper cuttings and then stick the paper strips together, and then they roll it and make it. So mostly the sticking of the thing and the coloring paper. The coloring thing is done by an epilepsy patient, and other work is done by schizophrenia patients of our various wards.
Do fit, Sushil.
हाँ,
Do
that's what.
fit.
Window fit.
फिटवर नाही फिटवर कर तिथे वर फिट आहे बघ
Where is
स्लाइड शो पण ऑप्शन आहे सर बघा.
स्लाइड शो पण
fit? हाँ.
फिट कर
Fit percent is showing.
नाही सर स्लाइड शो करा सर.
स्लाइड कर सकता है ऊपर स्लाइड देखो
Slide.
स्लाइड शो.
शो
नाही सर राईट साईडला बघा साईड शो बटन आहे. मी तुम्हाला व्हॉट्सअपवर पाठवलं पण. राईट साईडला बघा सर राईट साईडला.
Right side la slide show. Yes.
हा येणार Let's go by the old format only.
I think आपल्याला भरपूर
Yes,
शिकायचं आहे.
असंच जाऊया.
Yes. We'll go.
So the last
Sure.
one of the presentation is the rope mat. This rope mat is a very tedious process. It took 8 days for the patient to do it. So first the rope has to be woven and then it has to be made into patterns. So that was done by a patient with delusional disorder. Thank you.
Thank you so much, ma'am, for beautifully explaining this beautiful art. The next art is brought by Mahatma Gandhi Institute, from Regional Mental Hospital, Nagpur, and it will be represented by Dr. Reena Bachle, ma'am, who's a psychiatrist over there. I would ask Dr. Reena to please present the art.
I'm audible, ma'am? Hello?
Yes.
Yes, sir. Yes, ma'am, you're audible.
Yeah. Am I visible to all of you?
Yes. Yes.
Yes, ma'am, you are.
Okay, yeah. So, respected and generous Dr. Reena Kurpadi, occupational therapist from DK Center, Regional Mental Hospital, Nagpur. So, here I'm displaying the art and craft made by mentally ill patients from Regional Mental Hospital. In all these activities, both male and female patients are included. So, major activities we carried in our department are wool mat and doormat, woolen work, which is made on frame, and also which is done by weaving by female patients. Then doormat is also made on frame, and it is also made from sari by both male and female patients. Then you can also see the woolen purse in woolen article section. Woolen purse is also made, and purse from sutli is also made. Sutli, what we call soft rope, is also made. Then there is a sofa cover which is made on handloom. Then in tailoring section, our male and female patients stitch cloth bag, which we call theli or kapdi pishvi. Then ladies and gents handkerchiefs are also made, and on ladies handkerchief there is embroidery done by female patients. In seasonal activities like just Rakhi festival has gone, so in that seasonal activities we have made lot of rakhis, and during Diwali, we made diya decoration activities in bulk amounts, and all it is sold in our hospital and to the in OPD to the outdoor patients or relatives. Then we are also carrying out jewelry making activities. There is earrings making, hairpins making, necklaces and bracelet making. Then there is a toran, which we generally put on a door, toran and door hangings, which both male and female are engaged in these activities. And if we go to the paperwork, then there is a vocational activity in which we patients made paper plate, paper bowl, and packets, medicine packets, and gift packets, etc. And our very special activity is a tie and dye activity, which is unique. So the tie and dye activities, we engaged two male and two female patients, and a trainer was provided for this activity. So the whole tying of cloth and dyeing of color is made by patients. The cloth was tied in different shapes and sizes, and color, and it is dipped in color, and it is like heated for some time, and after that the cloth was cut for a sofa cover, like pillow cover, and the pillow cover is also stitched by our patient, and the embroidery is also made on it by our patients. So all these activities we are regularly carrying, we are regularly doing in our daycare center, and all the products made by the patients we are in OPD, and also we are marketing to the public. Recently, our Rakhi has been sold in bulk to the Rotary Club, Lions Club, which is sent by them to our soldiers on border. So it was a great initiative by the outdoor people also to encourage the mental patients for their socio economic rehabilitation. All the activities are purposeful, goal directed, which helps the patient to encourage and to think about themselves, to encourage their self-esteem, self-reliance, etc. That's all. Thank you so much, all of you, for giving me this opportunity to present this online art exhibition. Thank you so much.
Thank you so much, ma'am. Amazing work that is being done at Regional Mental Hospital, Nagpur. Ma'am, I just wanted to know.
Yes, ma'am.
So these are made by
Hello. Hello, ma'am. Yes, ma'am.
Patients. So
Hello.
I think.
Hello.
Sanjana, your bandwidth is low only, I think.
Ha.
You may
Sanjana.
have to go another place and see.
Yes. So we will go ahead with Mahatma Gandhi Institute of Medical Sciences. Yes. Any representative from MGIMS, Sevagram?
Yes, sir.
Okay.
Am I audible?
Yes, you're audible.
Yeah, good morning, everyone.
Yes.
Myself, Dr. Sheetal Patel. I am an occupational therapist
all the
working since
patients
5 months. Sorry.
Yes, go ahead.
Yeah.
really
Working since 5 months in Mahatma Gandhi Institute of Medical Sciences, Sevagram. Here I am
good
presenting.
at art, or do you teach them initially and
Sheetal, go ahead.
Yes, sir. So these are few sketches and the art and craft activities done by patients. As we can see in first picture, there is view while traveling. So this is made by 15-year-old girl. She was diagnosed with schizophrenia, and when she was in the ward, she was given different activities. But once I asked her to draw unstructured drawing, I usually give first. So she drew a road where by the sides there were mountains, and it was a night view. So this is a picture from her real experience while she was traveling to her village, as she used to travel to village to another village for education. So when she went to the road where there was a night time and there was a moon, so she drew that. And the next was the panda, small panda sitting behind the wall, she said. And the next was knitting done by a depression lady. The lady used to do this activity at home as well as her leisure activity. So she said by making doormat, she feel a little bit of motivated and productive doing something. So when she was in the ward, she made two of the doormats, and she used to feel like I rated her since first day of her admission till the discharge. So her mood was also improving after doing some activity, and there was a change in her like scale also, code scale, which we usually do to rate their activity. So there was a difference in score which was on the first day and the day of discharge. And the next image is the paper activities done, like a lotus flower. This was made by a alcohol dependent male patient. So when I asked him why you made lotus, he said that as lotus grow in the muddy water, but it has its own beauty. So he said that like after because of alcohol, I had many losses in my life, but after going from here, I'll be like a lotus. I'll try to be like a lotus. Means he like after what we hear from him, we think that he won't be uh, drinking or he won't consume alcohol again. Then there are the envelopes. These envelopes are made by different patients in group activity. So one, it was colored by a girl who likes flowers, and so she made flowers on it. And the other one had flower design and smiley or good morning. So different messages were written on the envelopes by the patient. And there is a rose made up of foam sheet, thin foam sheet. These are also a group activity. And one alcohol dependent patient made this man who is smiling. So he said that this is us, like we after getting discharged from hospital, we will be happier, or we will turn ourselves into better person. Ma'am, next please. So, first picture, it's a Gautam Buddha sketch made by a patient who was a Buddha follower. He said that, like, as Buddha gives a message of peace, calm, being calm always. So, he drew that. And one more recently made on 21st, this health is wealth is made by alcohol dependent patient. When I asked him why you made this health is wealth, so he said that health is everything for us. So I asked him, like, as you consume alcohol, how your health is going to be healthy? Like how your health is going to be good. So he said that after going from here, I won't be consuming it again. So I'll try to keep my health wealthy. And the next picture is drawn by a girl, 15-year-old girl. She was like she had visual hallucinations. So she said that in first picture she have drawn a lady with a red sari with her holding knife in her hand, and the black thing at the right corner is herself sitting in the corner. So she feels that the lady is going to kill her. And this was on the 13th of June she had drawn. And the other side, one was the bright side, other was the dark side, where she was also standing with the red color and a red sign she have drawn. And the same girl have drawn it after 2 days. A girl have drawn Tanushri is her name and Suchitra is her mother. So she have drew both of them very neatly, and she told that my mother is wearing red sari, but I'm not fearful anymore. So that hallucinations has gone, and she her fearfulness has also been reduced. So yeah, that's it. Thank you.
Okay. Thank you so much, ma'am. Next, we have art brought by the NKP Salve Institute of Medical Sciences, Nagpur. And for this, I would call upon Dr. Anand Khare sir, who's assistant professor over there, to say a few words.
Hello, I'm audible?
Yes, yes.
Yes, sir, you are.
Yeah. Good morning, and thank you for giving me us NKP a chance to present the paintings and some diyas which were made by the patients throughout in the ward. So normally, it is a routine activity with the patients that we ask and try to educate the patients about the need for doing various activities in their daily lives also, and we train them regarding this. So the first two pictures are made by our patients. Now the first picture on the left, it was made by a patient named Mamta, and she's a case of bipolar disorder. And when she came to us in mania, and after a week of treatment, when she got better, she told us that she was interested in this casement paper embroidery work. So, seeing this, we asked the social worker to get the required materials for the same. And in about 3 to 4 days, throughout the day, she kept on working. And about 3 to 4 days, the patient made the beautiful photograph which we see on the left. And seeing this, another patient mm, was a case of schizophrenia. She was recovering schizophrenia. She had good insight. She was on treatment. So she also asked us that train me also. And after that, our occupational therapist at the time, trained her on this case. This is called a casement paper, and we have to put the threads according to the design. It is a very intricate work and takes a lot of time, and you can see it takes a lot of concentration, and it takes a lot of focus also. So these two pictures, this embroidery work was done by the patients. And the next slide which I would like to present is of the diyas. So this is a routine activity, as Gawande sir had instructed us that to help the patient be financially independent also. So what we do, we help them in making the diyas and the rakis and the envelopes. This is one of the diyas for Diwali, and we have an exhibition in a college in which the whole staff of the hospital and the institute purchase they purchase these diyas, and all the financial proceedings of the uh, exhibition are given back to the patients. So they have a sense of achievement that they have done something, and they have earned something, so that helps them to increase their motivations also. Thank you for the time. Thank you, Sanjana.
Thank you so much, sir, for giving us an insight into our own hospital and all the activities that we do. Next up, we have few arts that we have received from certain private psychiatry institutes. The first art is this beautiful art made by a patient currently in Treat Me Hospital. I would ask Dr. Preeti Bhute ma'am, who's the director of Treat Me Hospital, Nagpur, to grace us with few words. Ma'am?
Yes, yes. Hello, am I
Hello.
audible?
Yes, yes.
Yes.
Yes, ma'am.
Good morning, everyone. Myself, Dr. Preeti Brute, practicing psychiatrist at Treat Me Hospital. This is a painting made by a patient who is schizophrenic with cannabis use disorder. This patient is a singer and a classical dancer and is talented in many other art forms also. The colors he has used are dynamic, showing his dynamic mindset, but the patient himself is introvert. So the painting of Krishna and Radha, they are showing the relationship of friendship, love, beauty, joy, which he sees in his parents. But sadly, he is lacking in these emotions and he feels very bad about it. The another one with the sister, please, Basha. The other painting is the patient himself and his sister. So when he was going out to stay away from his sister or family, he draw this painting for himself so that he could see it whenever he will feel lonely. But then he gifted it to his sister as she was more emotional than him. So he gifted it to his sister. And the third one, that Ganpati, please show it. Yeah, this painting, if you can enlarge the painting, it has lots of meanings. That painting has 12 hands, 7 chakra, gada, mala, book, tir. That is what he has told me. He's still admitted in our institute. Peacock, Shank, Modak, Surya. But then it has 4 empty hands and no mushak. Which he says it is a friend of Ganpati, that is showing his emptiness, loneliness, or lack of friendship. So with this painting is showing his spirituality, sweetness, knowledge. Then peacock showing companion, 2 peacocks, they are showing companionship. Then the power within, that Surya is showing, and ways to defend, that axe. So, but then there are many deficiencies in his life, like no friendship, many, he say uni, but then still the Ganpati is dancing and celebrating life. So he said, more finally he said that the dancing Ganpati is celebrating life with so much of loads, like that axe, hanging nose and all. Lot of expectation as might be from the parents, and emptiness and loneliness, but we have to celebrate the life. He feels having such sort of hobbies is must to deal with emotions, which he has shown very well in these paintings. They calm him down. Otherwise, because otherwise he is having many emotional and anger outbursts. These paintings shows his mindset, which otherwise he is unable to speak out, as he is very introvert person. So that's the meaning of his painting.
And cannabis and art goes hand in hand.
Yeah.
Great, great.
Okay, thank you.
Thank you so much, ma'am. Next, we have entry from Abhinav Clinic, which is run by Dr. Ashwin Bhattar, sir. I hope Ashwin sir is there online.
Yes. Ashwin sir, are you there?
I don't see him.
Acha, he's not there in the participants.
No, sir, he's not there.
Okay. Few of the paintings are there. Okay, we will go ahead with the next paintings.
Yes. Sir. Next up is a very beautiful mandala-like art by Sanjeevani Clinic. Sir, if you could say a few words about these arts.
Is he not there? Dr. Sheetal Lohkare, are you there?
Yes, sir.
Sheetal,
She's
please,
there.
please.
Sorry, ma'am. Yes, sir.
It's okay. Good morning, everyone. So this is I'm attached as a psychiatrist at Sanjeevani Hospital, Nagpur. This art is made by my patient who was diagnosed as psychotic depression 5 years back. Right now, she is maintained at olanzapine and fluoxetine combination And she done this art 1 year back when I motivate her to draw some Diwali greetings. When I come to know that she loved to draw such kind of paintings. Thank you.
Great, great, great. The perfection and the symmetry and everything is so wonderful in this art. Absolutely.
Lastly, from Maharashtra, we have this entry by a patient visiting Kirpekar sir's clinic.
Sir is
So I
there.
would like, yes, sir. So I would like Kirpekar sir to please share a few words about this patient and the art.
Kirpekar sir? Sir is there.
Maybe.
Fine, fine, fine. If sir comes back, then I'll keep searching in the participants list. We can go
Yes,
ahead. Yes, yes.
Yes. So now we are done with the state of Maharashtra. So over to you, Jeet sir.
Very good morning to all of you. There was a technical glitch and I was busy with my hands, so I will just start Gujarat with my own presentation if it is visible from my side.
Yes, 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 yes.
So I was just sketching with my pencil and a paper in hand. And this is Lord Krishna's picture with a peacock there.
Okay.
Playing Basuri. So I would like to invite, so next slide please, Hospital for Mental Health, Ahmedabad, to showcase the paintings.
Good morning, everybody.
Good morning, ma'am.
Sir, can I speak?
Yeah.
Good morning, everybody. I'm Dr. Vaishnavi Jhala. I'm from Gujarat Institute of Mental Health. Thank you for giving me this opportunity to represent artwork of our patients. First of all, I would like to sir, the screen is not visible. One
It's
second.
visible. You can continue.
It's
Sir,
completely
my
visible. We can see.
webcam is not working. So is it okay?
Yeah, fine. You can explain
Yes.
the artwork.
Yes, yes.
Okay. So the first artwork, which is in the right bottom corner, it is deeply moving and powerful piece personally to me because it was drawn by the patient of schizophrenia, which was postpartum in onset. So this artwork tells a story of transformation, struggle, and hope. So on the right side, we see a woman with almost a distant expression, and this represents the artist herself. She was weighed down by her mental illness. So through this figure, she reveals the depth of her suffering, and which led her through the painful experience of divorce and loss. So and in the very same picture in the left side, she doesn't means ki, on the left we see a more hopeful version of the same woman, and this figure embodies who she dreams of becoming, a vibrant and strong bride, and ready to reclaim her life and her dignity and her happiness. So despite all the struggles, she has preserved and found love again, and she remarried. And she said that I am the same, but I had dream of becoming a bride. So with the help of therapy and drugs, I have finally achieved my dream. So it was the description given by patient herself.
Very
And
nice. Thank you.
the second, yes, sir. The second
continue.
artwork created by the patient of depression. From Mahatma Gandhi, he represent a symbol of peace and resilience. And Gandhi represent the inner strength needed to overcome the challenges of depression. And around Gandhiji, we see famous monuments of India. So the monuments and landmarks reminded the patient stability and beauty, offering comfort during difficult times. So it was a description given by patient only. And the third and last painting was painted by a patient of mania. which depicts two women in traditional attire sitting in peaceful and serene environment. So their expression are calm and contemplative, evoking sense of inner peace and mental clarity post-recovery. So the use of color and intricate patterns and careful composition reflects the patient's regained focus and a renewed sense of control over their thoughts and emotions.
Yeah, thank you so much. It is very nicely done artwork. I would like to invite Government Medical College Surat now for the artwork.
Hello, can you hear me?
Yeah, ma'am.
Yes, ma'am. Yes, ma'am.
I'm sorry, I'm on the train from Pune IPS ESB conference. I'm back, going back home. Let me explain. I hope you all can hear me.
Yes, yes, you're
Yes, ma'am.
audible.
Yes, ma'am.
Now, this first watercolor painting is from a patient, a male patient of schizophrenia. He had treatment-resistant schizophrenia with persistent auditory hallucinations and all. And after 10 years, also, we put him on clozapine when he came to us. And also, he was quite drawn to paintings. So, what I did was, along with my daughter, I said, you have to sit with the drawing teacher because his drawings were so fragmented. In this picture also, you can see that the hands and feet and etc. He is not drawing them in continuity. Earlier, his paintings were so fragmented, so we actually were very surprised by that. As he improved gradually over 2 years, this is the painting he has done after 2 years of such training. And then we asked him to collage. So these are some themes he was drawing repeatedly. And we put this in our local show also. So as he showed improvement, his drawing and painting quality also improved, and which was really very good. But
Great, great.
Very nice. It's beautifully done, ma'am. I was wondering that it would
and
it
his
would be the
mother
best picture.
if he goes back to painting, probably he may be deteriorating. So his mother also is afraid. But I have all his painting. But this is one I depicted. This second one is of a patient, a lady with a severe OCD, obsessive compulsive disorder. And she had this obsessions and compulsions of not just contamination, also of symmetry and all that. And to break through that barrier, she used this embroidery, and we encouraged her. We treated her. She was much better on fluoxetine, 60 to 80 milligrams. And so, and this one is actually, this is, she has gifted to us kind of, but it's so well done and so meticulous. This is an embroidery on cloth. Yeah. Thank
Yes,
you.
ma'am. The first one I felt personally that the first one was. I guess
Thank you.
some mic. Thank you, ma'am.
Thank
Thank you
you.
so much. The
Yeah.
first one was really award-winning picture, and I felt so after getting the entry. Next, I would like to invite Medical College Baroda SSG Hospital. So, any representative from the side?
Hello,
Any
good morning, sir.
Yeah, good morning.
Yes, I am Dr. Ayushi Biswas, first year psychiatric assistant. This painting was by a patient, a 20-year-old female patient. She was admitted to our ward after she attempted suicide. She was diagnosed with major depressive disorder with anxiety features. Initially, in the first 3-4 days, she was very guarded. She would not say anything. She would just stay inside, just keep on sleeping all the day. Eventually, our consultant, we used to talk to her morning, evening, as whatever time we got. So eventually she opened up, and then she told that she's interested in art, and her mother was a doctor and father was an engineer. So obviously her parents wanted her to pursue medicine or something, but she was interested in art. So initially, then she told us she felt that she was unheard by her parents, her family, even her friends. She expressed that she wanted to feel the freedom to be herself have her own perspective, which might not align with the society. After 10-15 days, she recovered. She was much better. And at the time of discharge, she presented us with this token of gratitude. When we asked her why she chose the blue background and orange color for the bird, because usually we draw the bird as blue, black or something. She said that orange color she chose because it signifies fire, which can signify how personal growth is important to her. She wanted the freedom to be her own self, and that's why she chose the color. She wanted to have the space and acceptance from the society also and her parents. So that's why this was given to us. Thank you.
Very nicely done. Thank you so much for the presentation. Further, I would like to invite Dr. Priyanka to present the PPT paintings from Goa. Thank you so much. Thank you so much.
Yeah, a very good morning to everyone here. Next, we have Dr. Rajesh Dhume, who will be telling us about a painting from the North District Hospital in Mapsa. So, if sir is here. Dhume sir?
Yes, sir is here.
Yeah, yeah.
Am I audible, Sushil?
Yes, sir. Yes,
Yes,
sir.
sir. Yes.
Absolutely.
Yes.
Okay. Priyanka, should I go ahead or you have something to say?
No, sir, you go ahead.
Okay. So was born to a was a polydrug abuser and also used to deal with carpets in Goa. And that's where he had a relationship with a German tourist and ended up having 6 children, 2 boys and 4 girls, and 1 adopted child. This child grew up and was abused and started staying on the road. Have some sort of musical talent in them. And this girl in particular joined the Fine Arts College. In the Fine Arts College, she was probably having prodromes of schizophrenia, wherein one fine day she was raped in the toilet by 4 of the college mates. It became a big case. And the case went on for some time, and you know how cases in rape are. But soon after the Dora, tides, all this type of other things were done, and medication was stopped. So she relapsed, and she had to be put into a rehab home for many years. So when she came to me in 2004, 2005, she was like written off by family and written off by everybody. So we had to work on her, and it took us about 6 years to bring her to this stage. What she depicts in this is the orange part is how she was. And then after particular treatment, supportive psychotherapy, anything, the window opens. And then she takes a flight towards normality. At this point of time, she had perfect insight. Right from I've got around 12 or 13 paintings of hers in the OPD with all mental health themes of the mental health day of that year. And I just tell her the theme and she paints it and gifts it to us. She has online, she does online. Now she's employed as an art teacher. She looks after herself. She's now into a stable relationship also, and she has got an online exhibition. So that is where the patient is right now. Thank you. Thank you for the opportunity, actually.
Thank you, sir. Thank you.
Thank you so much, everyone who have attended today's program. As Sushil sir just texted in the chat box that it was a practical class of TAT that we had today. Now I would like to call upon Dr. Dhananjay Ashturkar sir, the Secretary for IPS West Zonal Branch, to say a few words and share his experience for today's CME.
Sanjana, he has left. He
Yes.
has some
Okay.
important work at home. He has left.
Okay, sir. So no issues.
No
I
issue.
would now like, no, sir. Sir, Dr. Gaurav Haldankar sir is there, the convener for Arts and Culture Committee.
Yes, I'm there, Sanjana.
Good morning, sir. So if you
Good
could please comment
Yes.
upon today's exhibition and your experience.
Sure. Thank you, Sanjana. Thank you, Dr. Sushil, for giving this opportunity to give the vote of thanks. I have turned off my video for the bandwidth to support me. First and foremost, I would like to thank the people who have graced us with their artwork today. It was amazing to see different kinds of artwork being presented, the paintings which were true to the essence of the person's expression, and it exhibited much more than just for us clinical professionals to kind of point out or kind of see what lays behind those paintings and artwork. It is more so for us to just appreciate the art for what it is, and just we were graced with some beautiful artwork. I would like to sincerely thank our ever dynamic and supportive IPS West Zonal Branch President, Dr. Neena Sawant ma'am, for being ever supportive of our uh, programs. Dr. Dhananjay Asturkar, who was there throughout the program, it just left just a short while back, for being always present at our programs and supporting us in all our ventures, and all the IPS West Zonal members. Our dynamic Dr. Sushil Gawande sir, so for being very motivated to portray the art and culture as a paramount and important part of psychiatric practice and life in general. So it was a wonderfully curated program. All the moderators of the sessions, Dr. Jeet Natpara, Dr. Sanjana Jaiswal, Dr. Priyanka Sasabojani, okay, did a wonderful job in compiling the artwork from various hospitals and private institutes and government institutes throughout the zone. I would not miss out and mention our advisor, Dr. B.S.V. Prasad, co-chairperson, Dr. Monali Deshpande, who for whatever reason could not be here, and I'm replacing her on her behalf. I'm giving the vote of thanks. EC coordinator, Dr. Amol Deshmukh, and all our members. Would like to end with just sort of saying that art is an expression of, is not only an expression of our thoughts, but an expression of our emotions, intuition, desires, but it is even more personal than that. It is about sharing the way we experience the world, for which it is an extension of our personality.